Good afternoon. Today is March 23rd. My name is Stacy Wood. I am the Health and Human Services Public Information Officer. Today's community update includes updates from Dr. Jennifer Mullendore, the Buncombe County Health and Human Services Health Director, Interim Health Director, and Medical Director. Fletcher Tove, Buncombe County Health and Human Services Preparedness Coordinator, Director, and Avril Pender, Buncombe County County Manager. So we have tried to address some of your previously submitted questions in the content of these updates. I will be sending out an email to everyone on our email list with responses that might help address some more of your specific questions. Dr. Jennifer Mullendore is up first.
Good afternoon. Yesterday afternoon, Buncombe County Health and Human Services issued a press release informing the public that a total of 3 Buncombe County residents had tested positive for COVID-19. Since that press release, we have become aware of 5 additional residents of our county with COVID-19, bringing the total at this time to 8 cases of COVID-19 in Buncombe County residents. As additional lab results from tests performed by local providers and Buncombe County Health and Human Services return, we expect the case count to continue to increase. Buncombe County communicable disease staff have contacted each individual with COVID-19, informing them of their test results and obtaining information on their close contacts and whereabouts during the time period of interest. Each of them remain isolated away from the public. Close contacts of these individuals with COVID-19 are being notified and issued guidance on monitoring themselves for symptoms and what to do if symptoms develop. Investigation to identify the source of infection for each person with COVID-19 is ongoing. At this time, travel to affected areas outside of North Carolina is the likely source of most of these infections. However, we have not identified the source of exposure for at least 2 of these cases. This suggests that there is local community transmission of COVID-19. We have received calls and questions from the media and the public asking for more details about the cases of COVID-19 in our county. Examples include where did they work and where did they visit. Please know that the safety and health of the public is our #1 priority. We also need to follow the law when it comes to sharing information about a person who has a reportable communicable disease like COVID-19. We must protect the privacy of these individuals. It is not best practice or beneficial to notify the public of the locations that a person with an illness like COVID-19 visited during the time they had symptoms. This is because it is predominantly spread to close contacts by droplets. Someone who was in the same space but not within 6 feet of the ill person for at least 10 minutes would be at low risk for infection, and the guidance to them would be the same as the general public. If you develop symptoms of COVID-19, stay home and call your healthcare provider. The concern is that public notification causes increased public anxiety and does not assist in the identification of new cases or in our general public health response. In the setting of a case of measles, which is spread through the airborne route, including to others who share the same airspace, after the person with measles has left that space, public notification is more beneficial. As we see local cases due to community spread, it will be important that the public does not become hung up on knowing the specific locations where people with COVID-19 went. At this time, we must all assume that the virus that causes COVID-19 is in our community and we are all at risk. We must each take personal protective measures to avoid exposure. The guidance that we have been sharing with the public and the actions that Buncombe County has taken over the past several weeks have been focused on preventing and minimizing the spread of this infection in our community. I have said it before, and I will say it again now. It is critically important that everyone follow this guidance to protect themselves, their family, their friends, their coworkers, their customers, and our entire community. I cannot emphasize how important these measures are. We must all do our part. The actions we each take matter. Number one, if you are sick, please stay home away from other people. By going to work or out into the community when you are sick, you are exposing everyone around you to your germs, including to possible COVID-19. Please stay home. If you are over the age of 65, or if you have a chronic health condition like heart or lung disease, diabetes, or a weakened immune system, please stay home, away from others. Protect your health. Each and every one of us needs to keep our distance from other people. Social distancing is key to stopping the spread of this illness. Stay 6 feet away from other people. And young adults, I get it, you're out of school, or maybe you're not working right now, and you want to go and hang out with your friends. But please don't get together physically. Instead, use apps and social media. Stream movies together virtually. Get creative. While you may feel healthy, it is possible that you are infected and can pass your infection along to others, your friends, your parents, your grandmother. I don't want you to be the reason that someone else ends up in the hospital or worse. Number 4, please wash your hands frequently with soap and water, or use an alcohol-based hand sanitizer. Hand hygiene is key. Number 5, please avoid touching your eyes, your nose, or your mouth with unwashed hands. Number 6, cough and sneeze into your elbow or a tissue, and then throw away that tissue and wash your hands. Number 7, clean and disinfect objects that are frequently touched. Don't forget your cell phone or doorknobs. As we are now seeing community spread of COVID-19 in our state and locally, North Carolina Department of Health and Human Services guidance to healthcare providers on testing for COVID-19 is changing. Testing is no longer recommended for individuals with mild illness that can be managed safely at home. The reason for this is that people with mild illness due to COVID-19 who leave their homes for testing may end up spreading the illness to others, including healthcare personnel and high-risk individuals. Additionally, people who leave their homes for testing may expose themselves to COVID-19 if they don't already have it. Most people with COVID-19 have mild illness. Testing will not change the management of those individuals. Testing will become focused on individuals who are hospitalized or severely ill, healthcare personnel, and those individuals in congregate living settings like nursing homes, jails, and homeless shelters. Another reason for the changes in testing is that we need to conserve our critical supplies. We know there is a nationwide shortage of personal protective equipment used by healthcare providers and first responders. Efforts are underway to increase the supply in North Carolina and locally, but we need to not waste what we currently have on hand. We also need to limit the exposure of healthcare personnel to sick individuals who may have COVID-19. Based on all this information, and in an effort to ensure the most effective use of our resources, our testing supplies, our personal protective equipment, and our healthcare personnel, Buncombe County made the decision last week to not continue community testing, and that remains the case today. Our guidance to you is that if you develop fever and cough or difficulty breathing, contact your healthcare provider by phone. If you are critically ill, call 911 and tell the dispatcher what symptoms you are having. If you have general concerns about COVID-19, please visit buncombeready.org. And if you are a Buncombe County resident and you don't have a healthcare provider and are concerned about symptoms of COVID-19, you may call a Buncombe County communicable disease nurse at 250-5300. Thank you.
Good afternoon. I'm Fletch Tove, Public Health and Emergency Preparedness Director. Buncombe County Public Health is continuing to work to ensure that our response to COVID-19 remains proactive. We have implemented mitigation measures to slow the spread of COVID-19, but that also factored in the eventuality of community spread in our area. We are continuing to track and assess the latest information and guidance from experts around the globe as we determine what are the best actions to safeguard public health in Buncombe County. Our Emergency Operations Center has entered its second week of full operations, and as part of that response structure, we have convened several working groups to address the most immediate needs of our community. These working groups are leveraging resources throughout Buncombe County from government, nonprofit, and private sectors to address a range of medical and non-medical issues. Examples of these efforts, of these working groups, include the support for those experiencing homelessness, food and nutrition stability, transportation needs, childcare, behavioral health, and aging. Over the weekend, we spoke about how our community needs to come together as one Buncombe. We spoke about our county motto, people to match our mountains, how we are strong and resilient, how we help each other in times of need. Over these last weeks, we have seen incredible support from individuals, grassroots organizations, and local businesses who are partnering with our Emergency Operations Center to provide essential resources and complete essential tasks. We want to thank members of our community who have been assisting in our response efforts. And we also want to thank all the community members who have been complying with our guidance by limiting mass gatherings, staying home when they are sick, staying 6 feet away from each other, and washing hands with frequency. Please remember, this is a community response. Every one of us has a responsibility to participate in all of these best practices in order to minimize the impact of COVID-19 in Buncombe County. Thank you.
Hello, Buncombe County. I'm your county manager, Avril Pinder. Many of you are watching this from your home, empty offices, and other spaces different from what you're accustomed to. Make no mistake, we are in uncharted waters. Fear and uncertainty are abundant and tangible in ways we haven't seen for generations. While fear is real, it is not absolute. Fear will not have the last word. We are stronger than fear. To those unnecessarily sowing seeds of anxiety, I ask you to join us in using that energy to be agents of positivity and reassurance. And use your platform and influence to help us save lives by communicating information vital to slowing the spread of this disease. Our faith, our compassion, and our resolve will dictate what happens in Buncombe County and across the nation. And as we band together as a community, our actions will drive fear back into hiding and serve as an example of light and resiliency. As for the uncertainty, we are responding to multiple unknown variables. We have taken guidance from experts in the medical and scientific communities and treated this as a public health crisis from the onset. Our public health and emergency services personnel have been planning for weeks, with the culmination of establishing our Emergency Operations Center last week. That EOC is staffed with experienced and dedicated members in our community. They have as much at stake as you and I do, and I can assure you they're acting accordingly. In the coming days, weeks, and months, we will continue to meet uncertainty head-on with an unwavering commitment to public service. That brings me to you. Our normal way of life has changed. That is not lost on me. These are unprecedented times, and they call for equally unprecedented measures. I know this is a big ask, but it's not from me. It's from our community most vulnerable, our neighbors, our friends, and the future generation. It is imperative that we embrace the sacrifices asked of you and me. The future will judge us by our humanity in this situation, when we know the difficult path is also the most compassionate way forward. We must lay down our apprehensions, belay fear and uncertainty, and find shelter and dignity in knowing our reward will be emerging from this public health crisis when our community is still intact because of the choices and actions we take today. And when the final chapter is written about this moment, I have no doubt that when our community is weighed, we will not be found desolate and wanting. I want to thank our staff, first responders, public health workers, community partners, nonprofit, our neighboring municipalities, our school system, and our business community, and everyone else that is working diligently to coordinate a community-driven response. And I want to thank you for your understanding, for the gravity of this situation, and ask that you act accordingly. Thank you, be well, and God bless.
To echo everybody who has spoken today, we continue to respond to the most urgent needs in our community while at the same time trying to think ahead, several steps ahead, always forward thinking. For accurate information on COVID-19 in Buncombe County, we want the community to go to buncombecounty.org or buncombeready.org for up-to-date COVID-19 information. This is the most accurate and reliable source of information related to COVID-19, related to county operations, that you can all access on your internet. We are also asking the community to sign up for BC Alerts to receive important information, and that can be done by texting BC Alerts to 888 777. Again, buncombecounty.org is the source for the most accurate information on COVID-19. Thank you.